The rural health crisis in America is a growing tragedy, and when it comes to obesity-related cancer deaths, the numbers are sounding a grave alarm. Rural communities, already burdened by poverty, poor infrastructure, and limited access to medical care, are now facing some of the highest cancer mortality rates in the country, especially cancers linked to obesity. And unlike in urban areas where advanced treatments and early screenings offer some defense, rural residents are often left without even the basics of prevention. At the center of this crisis is a cruel paradox. The people most vulnerable to obesity-related cancers are the least likely to receive the care that could save them. Geographic isolation means longer travel times to hospitals and specialists. Many counties don't have a single oncologist, let alone access to nutritionists, fitness programs, or mental health services. Routine cancer screenings like mammograms, colonoscopies, and pap smears are skipped, delayed, or simply unavailable. For cancers that require early detection to improve survival, this lack of access is deadly. Obesity itself is more prevalent in rural areas, driven by factors that go beyond individual choice. Rural residents often live in food deserts, where fresh produce is scarce, but fast food and processed snacks are everywhere. Physical activity is harder to come by when there are no sidewalks, parks, or gyms. Wages are lower, health literacy is weaker, and health insurance coverage is less reliable. Under these conditions, obesity isn't a failure of personal responsibility, it's the result of systemic neglect. The consequences are staggering. Cancers of the breast, colon, kidney, liver, and pancreas, all strongly linked to obesity, are killing rural Americans at higher rates than their urban counterparts. And the disparity is widening, not shrinking. Even when rural patients are diagnosed, they often receive suboptimal treatment. Late-stage diagnoses are more common, surgery may be delayed, and chemotherapy or radiation might be inconsistent or entirely unavailable due to workforce shortages and underfunded facilities. What's more, the emotional and psychological toll of cancer in rural communities is often ignored. Patients may face isolation, limited support networks, and cultural stigma surrounding both obesity and cancer. Many delay seeking care out of fear, mistrust, or sheer logistical impossibility. And in these areas, preventable deaths are far too common, lives lost not just to disease, but to broken systems. Public health efforts have largely failed to address this growing disparity. Most national cancer awareness campaigns don't reach rural audiences in meaningful ways. Federal funding rarely prioritizes rural health infrastructure, and healthcare consolidation continues to shut down small hospitals and clinics, forcing patients to travel hundreds of miles just to access care they should have nearby. The result is a two-tiered cancer system, one for cities and one for the rest, where outcomes are worse and hope is harder to come by. There's no way to solve the obesity cancer crisis in America without confronting the rural health divide. That means expanding Medicaid in states that haven't, investing in rural clinics and telehealth, training more rural oncologists, and creating targeted obesity prevention programs that actually reflect the lived realities of these communities. It means recognizing that health is not a privilege based on zip code, but a right that has been long denied to tens of millions of Americans. If we don't act, the rural cancer death toll will keep rising. Not because we lack the science to stop it, but because we've refused to make it a priority. And that is the true tragedy behind the rural health crisis: preventable deaths made inevitable by inaction.